otolaryngologist or an ear, nose, and throat doctor.
This is coming to you live from Metropolitan ENT and Facial Plastic Surgery. We have Dr. Michael Abidin, who's going to be discussing the balloon sinuplasty procedure. Dr. Abidin is a top ENT, and he is really excited to share some incredible information with you today. Go ahead, Dr. Abidin. Thank you for your time today.
Well, thank you for having me. So, my name is Dr. Michael Abidin. I'm an otolaryngologist or an ear, nose, and throat doctor. And today we're going to talk a little bit about sinus surgery and some of the advances that we have. I have a book that I show my patients, and this was really to show in the old, kind of the old new way to do the sinus surgery. And what we would do is we would look for areas that were blocked up, and then we would open up the passageways so that they're wide open. Black is nice for air. And so this was a surgery that was done through the nose. There's no black and blue, no packing, no splints, and was a lot less invasive. And we called it functional endoscopic sinus surgery. It started when I was at Johns Hopkins, and so that's when I got started. And this was the new thing at the time. And what happened at that point was we reduced the morbidity, and the success rate went up into the 90s. So when this was going on, I was like, well, I wonder what's going to be better than this in the near future. So what we have is we're here in our lab, and patients come in, we have them sit. The procedure is done directly under local anesthesia. We can have family members stay in the room just to keep people calm. And then we use this device. This is a state-of-the-art computerized device, and what we do is we attach probes to the patient, and what it does is it reads our CAT scan, and then as you're operating on the patient and you're looking at their anatomy through the telescope, you can also look up on the computer. And there are even ways to do things called virtual cameras, and basically what we're trying to do is find the spaces that are tight and blocked up, or the holes above the sinuses, and you put a device in there that expands to 180 psi, and it literally pushes the bone out. When it does that, the sinuses tend to heal openly and they drain well. It's funny, this is a pretty old thing. And so what we've done is we've reversed it so that there's no cutting involved. There's oftentimes no bleeding involved, and the downtime is slight. I've had patients come from out of town, have the surgery, and then fly back to wherever they came from within 2 or 3 days. So what we've done is we've taken a sinus surgery, which was, when I was a medical student, a very difficult procedure that had high risk and poor outcome, to a more advanced procedure based on an endoscope looking up people's noses, to now not only the endoscope but a computerized device that then allows you to track where your instruments are in the patient's head, preventing complications and allowing for more accurate and successful surgery.
That sounds great. It sounds like it's really revolutionized this entire sinus procedure, sinus surgery, yes?
Yes, and what happens is it does. We've even had people drive themselves. I had this 86-year-old woman who came in, and she said, you know, I don't want to bother my friends, because usually we like to give people a Valium. But what we did is we packed her nose with topical anesthesia. We used very ridiculously tiny needles. We numbed the patient up, and she actually drove herself. Came in, 86 years old, we ballooned her sinuses, drove herself home, drove herself back, and unfortunately brought me candy, which I tried to get rid of the next day. But it works that way. And when I tell people, how does this compare to major dental procedures? They're like, oh no, this is much easier than a major dental procedure.
That's great. Well, this sure has been helpful information today, and we really appreciate you taking the time out of your very busy schedule to update all of us on this balloon sinuplasty procedure. We're going to look forward to doing some follow-up with you in the future on some patients with this procedure, and I just want to thank you for your time today, Dr. Abidin.
Great, thank you.
Yes, coming to you live from Metropolitan ENT and Facial Plastic Surgery in Alexandria, Virginia. We are signing off for now, and have a great day.